Hi, my name is Melanie Dabbs, and this is my presentation on depression for psychopharmacology and Professor Shirley Sarr. To explain the neurotransmitter theory behind depression and how the drugs used to treat this disorder affect those neurotransmitter systems. It is the monoamine deficiency theory posits, which is a depletion of the neurotransmitter serotonin, norepinephrine, or dopamine in the central nervous system, but it is the underlying pathological basis of depression, though. Then again, the neurogenetic theory is a result of the relatively recent discovery that, contrary to what we once believed, is the existing neurons are able to repair themselves, and that the brain is capable of making new neurons by making certain chemical compounds that could help people who suffer from psychosis, depression, anxiety, mania, and other neurological and psychological conditions such as fluoxetine or Prozac, which serotonin reuptake blockade and secretion of neurotrophic factors in the hippocampus, proving to help the condition. To evaluate the risk and benefits of treating a patient with the most common type of medication and of not using drugs to treat a patient with depression. Depression can be a consequence of stress, any injury, disease, or physical trauma damaging to the brain and weakens its ability to recover, but antidepressants relieve depressed moods by acting at the cellular level to promote neuronal survival and reverse stress-induced neuronal damage. Unfortunately, can have a risk as a treatment. The most common type of medication for treatment is selective serotonin uptake inhibitors, or SSRIs, and possible risks can include nausea, vomiting, diarrhea, headache, drowsiness, dry mouth, insomnia, nervousness, agitation, or restlessness, dizziness, and even sexual problems. Mortality rates associated with the drug use to treat depression and considering not using medications to treat depression. Selective reuptake inhibitors had high rates of fracture to the tricyclic and related antidepressants, but lower mortality and adverse drug reaction rates than the other antidepressant drug classes. Other treatments can include therapy, exercise, self-help groups and books, and even in extreme cases, electric shock treatment. To take into account the natural course of the illness, the rate of spontaneous recovery, and the rate of mortality when untreated, and remission rate of depression. Most clinical trials report remission rates of 22% to 40%, while clinical practice reported lower remission rates of about 11% to 30% in 2008, surprisingly. Here are my references, and thank you for listening to my presentation.